Hi, thanks for joining us once again. This is Paramedic Project, and today we are once again talking about laryngoscopy and starting to expand on some themes around the actual skill itself. So the first big thing that I want to impress on you is, just like IV cannulation and the concepts of adult skill acquisition around adult cannulation. First of all, when you start practicing the skill, you're going to be pretty ordinary at it, but you need to stick with it and keep going to work through that kind of phase when you're learning the skill until you get proficient. And a big part of learning the skill and the actual what the skill looks like in its entirety is not only just grabbing a laryngoscope and putting it in someone's mouth and clearing it. Just like IV cannulation, we need to, every time we practice this skill, we need to meticulously set up our equipment. And the equipment for mine is a laryngoscope, some McGill's forceps, and our suction. Okay, so we need to have those things there when we're doing laryngoscopy for the purpose of clearing a patient's airway. And unlike IV cannulation, this skill, when we're clearing a patient's airway, when we perform it in real time, it is going to be life-saving. So the pressure is going to be on even more than when you're putting a cannula in someone. So it's even more important to practice this skill in its entirety and set our equipment up every single time. Not only should we get the equipment out, but it needs to be placed in the appropriate place. And for mine, that puts the laryngoscope and the handle on the left-hand side of the patient's head, and the suction under the patient's right-hand shoulder, and the McGill's forceps just next to our suction. And that then means that when we're performing the skill and our left hand is full with our laryngoscope gaining the view, once we view the obstruction and the patient's vocal cords, we keep our eyes on that and our hand in exactly that position so we maintain that view. Our right hand, our free hand, can then drop down and find our suction, find our McGill's forceps, and then use that. So the big thing that most people do when they're not used to this is they go in, they don't have their equipment set up, they see it, they go, oh yes, there's an obstruction. Then they say, oh, but I don't have my suction and my McGill's forceps ready, so I have to come out, put things down, find more equipment. And in those few vital seconds, the patient's condition changes. Maybe they get trismus, or they vomit again, which means it's even more difficult or actually impossible for us to get that view. When you get a chance to get that view, you need to take that chance, and that means that when you take that chance, everything needs to be prepared well. So that's the first big thing. When we're practicing the skill, practice setting up our equipment appropriately, and practice actually using our right hand to pick that auxiliary equipment, which is used to more clear the actual obstruction, and our left hand's used to actually gain the view. So that's my first tip when we're practicing it. The second thing to notice is that often when we as paramedics, beginning paramedics, student paramedics, people learning the profession, most of our practices will be on a mannequin. And that's just reality. It's very difficult where I work anyway to get access to real patients to actually practice laryngoscopy on. Saying that, if you do get the chance to practice on real patients with someone experienced looking over your shoulder, and it's just in a controlled environment like an operating theatre, that experience is invaluable, so you need to take that opportunity. They can give you tips on your technique and how to position the patient better to gain a great view. So that's a really good point. If you get that opportunity, to absolutely take it. But the reality is that usually our practice will be on mannequins. And that's an excellent substitute, because it means that we can gain the dexterity needed with this left hand, gain the strength needed with that left arm to actually displace the anatomy and gain the view, and actually feel what it likes for that tip of the blade to be in the right place when we're gaining view of the patient's airway. That's the second point. Third point is the patient's position. We look at the patient's position here. In hospital, when if you're performing this skill, the patient is usually on a hospital bed, which means we can elevate the patient's position to close to our eye height, just so we can gain a view really easily into the patient's airway. Our patients, when they're sick, they're unconscious, they're choking, they're going to be on the floor, which means that we can't elevate them up. We have to get our eyes down to them, which is something really important that you need to do in your practice also. So it's important that these patients, when we practice them, they're on the floor. It's a very, very different skill set to putting them on a hospital bed and being able to change their height. So they're the big points to start practicing this, set our equipment up, Do a lot of practices. Like any skill, you're going to suck at it initially, but then you'll get better. And thirdly, make sure the patient is positioned as they would be positioned when we go to a real ambulance scene. That would be on the floor, supine. So they're my first big tips for learning the skill of laryngoscopy. And join us for our third episode on laryngoscopy coming up, where we'll talk a little bit more about one or two more important things when we're actually learning the skill. Thanks for joining us once again. It's been Paramedic Project. Find us on social media, and we'll see you next time.